Hello, my name is Tyler Solberg, and I'm glad you've taken the time out of your busy schedule to sit down and talk to me about some issues that have been happening in our healthcare system. Some of these issues are across America and across the globe, and they can range from rising healthcare prices, standards of quality, and lacking of quality in certain aspects of our healthcare system. One of the biggest issues that I've noticed in recent years is the lack of quality in rural America. This widespread case has been prevalent for years now. However, it continues to grow due to several factors, which include hospital and patient care funding, shortages in healthcare professionals, and the costs incurred from uncompensated care provided. Moreover, the prevalence of healthcare within rural communities is a perpetually growing issue as quality continues to decrease and hospitals become scarce. The most impacting factor when discussing the quality of healthcare in rural communities and healthcare across the entire spectrum of the U.S. healthcare system is the cost factor. The ever-rising costs associated with healthcare is the foremost issue that rural communities within our country face. Many rural community hospitals and healthcare providers lack in quality care because of several issues which are directly linked to the funding and uncompensated care. These problems include outdated systems, obsolete equipment, and inadequate training, which all affect the quality of care the patient receives. With proper funding, processes could be updated, state-of-the-art medical equipment could be attained, and proper training could be offered, which provide the highest quality of care for the patients. The fiscal issues stem mainly from uncompensated care that these hospitals incur. Many rural communities are victim to low wages where families and individuals alike cannot afford premium health care costs, relying on government-backed programs such as Medicaid or Medicare. This causes less money generated in hospitals, where most patients rely on the care they cannot afford. A prime example of this predicament is taking place in Alabama, where according to William Thornton of AL.com currently, rural community hospitals across the state are struggling to provide quality care and keep doors open with close to 90% operating in the red, due to patients not being able to afford the care given and lack of reimbursement from the government. This is only one example of many across the country and many parts of the world. Tennessee especially is affected by cost and related issues with rural communities. So much so that the Wall Street Journal reports that they have one of the highest per capita hospital closure rates in the entire country due to unsustainable fiscal systems, which causes a decline in quality. These examples give us an inside look on how immense this matter is and how it causes a deterioration within our healthcare system. Moreover, funding and the capability of those in need of care to pay for healthcare is at the core when discussing quality healthcare within our rural communities. Another profound issue that has been causing the decline of quality within our healthcare system and in these rural communities is the shortage of healthcare professionals in these locations. Without quality healthcare professionals available, many hospitals and healthcare providers will have quality decline in their systems. Many healthcare professionals flock to urban areas where they can have higher wages, better benefits, and better quality systems that they want to be associated with. This, in result, has less quality healthcare professionals for these rural communities, thus a decline in quality. The authors of the article Rural and Remote Health recognize that the continuing disparity between urban and rural communities by seeing that communities in rural areas tend to be sicker, less educated, and more impoverished than those of the urban areas. This, coupled with less high-end healthcare professionals, results in a devastating decrease in quality products and services for rural communities who need higher levels of care for those that cannot afford it. Although the quality of healthcare in rural communities is a perplexing issue without a clear answer or a quick fix scheme, there are tactics and decisions that could be made that will fix or alleviate some of these issues at hand. One of the main tactics to alleviate financial burdens and increase quality output is to implement strategic planning tactics. Ghosh and Davis explain in their book Quality Management for Organizational Excellence how implementing strategic management and planning can increase quality, productivity, and reduce costs by implementing a vision and objectives. Rural healthcare professionals must also install a vision across the board to make quality at the forefront of everyone's mind. Another way to increase quality is to bring ethical values to the core of healthcare facility in order to produce products and services at the highest caliber of quality. By changing the mindset of rural healthcare providers, quality will ultimately increase. Overall, rural Americans face difficult situations regarding the quality of healthcare within their communities. However, despite these continuing issues, there is progress that can be made to increase quality of healthcare and provide quality services and products in these regions. I really appreciate you taking the time to sit down with me today and discuss this matter, and I hope you have a wonderful rest of your day.